When I get older, losing my hair, many years from now, will you still be sending me a Valentine?
Good afternoon and welcome to Berkshire Senior TV. My name is John Lutz. I'm the Executive Director of Elder Services of Berkshire County. Thank you for watching. Today we have a great guest and one that's going to offer some pretty wide perspectives about Berkshire County, and that's Dr. Mark Pettis from Berkshire Health Systems, who's in charge of population health. So that's a big call, to be in charge of 128,000 people here in Berkshire County. So what does that mean? You know, when you think about population health, what does that mean to the common man?
And population health is the buzz these days, John. It's really part of healthcare reform is to transform our systems of care to improve the outcomes of those we serve, and to do it by being better stewards of resources, trying to reduce the cost associated with American healthcare and care here in the Berkshires, but to help people live longer and to live well. So part of that goal is not just longevity, but it's quality of life, and we all know how critical that is. So this is a very new wave in the transformation of healthcare nationwide.
And it seems like, at least in the materials you see or articles you might read, news stories, one of those aspects seems to be in actually having people interact with the health system, the official system, less.
Yes.
Which seems a little bit counterintuitive. Like, we want you to be healthier, but we want you to be in touch with us. So help us understand what that means.
It does seem paradoxical, and when you look at the determinants of health, what we now know is that what happens in a doctor's office or in a hospital, while it's critical, and we all want great doctors and good hospitals, and we have an amazing system here in the Berkshires, but most of what enhances health is lifestyle. And what people need to eat better and to move more and to connect with others in a more loving and supportive way happens outside of clinical settings. So population health is rapidly moving from using a lot of healthcare resources to attempting to use fewer of those resources and to shift a lot of that education, a lot of that support into the homes, into the community settings, into places where we have many in Berkshires where people gather and live their lives. So it is a very different model for how we think about healthcare.
And I think I've seen even just recently, kind of breaking it down into percentages, that as much as 60% of your health and well-being might be determined by these social determinants as opposed to medical or going to your doctor or taking a particular prescription or something like that.
Yeah, exactly, John. We know that a person's education level, a person's socioeconomics, what their income is, whether it's a one-parent or two-parent household, the kinds of traumas that might exist within a household, from substance use, addiction, physical, emotional traumas, how connected people are, transportation, all of these social determinants we now understand drive most behaviors that ultimately lead to health outcomes. So while going to a doctor is important and maybe getting a prescription, everybody knows that there's so little time. Ultimately, people need more support in their lives, and that can be challenging, particularly in modern life.
And how does a system like Berkshire Health Systems, which is the health system for Berkshire County, how do you approach that shifting kind of dynamic within the larger healthcare world? I mean, the health system, all health systems have kind of been functioning in a certain way for a long time, and now all of a sudden, now we're going to start to do this, or we're going to think about it. I mean, how does it, is it like an oil tanker trying to get it to turn? But
and it is a huge shift, John. Right. So part of it starts with having as much information as you can regarding those you do serve. So of the 130,000 people in Berkshire County, we know that there's a percentage, say 10% for example, that have more extraordinary and complicated health needs. So part of this evolution is to develop your systems in ways that will allow you to identify who those people are. We would call that sort of medical information systems, electronic records. The other big part of that is creating more community partnerships. So understanding that the clinical and the community integration and collaboration is more important than ever. So in that context, it's really about meeting people where they're at, in the workplaces, in faith communities, at senior centers, partnering with our boards of health and other community stakeholders like the Y, the Northern Berkshire Community Coalition, et cetera, et cetera. So we live in this beautiful place that has many stewards whose missions are in some way designed to help people live better lives, but historically they've not been as integrated with our healthcare system. So we now understand that good health is really something that we're all in some way responsible for. And so part of this reform is to develop models that can help you more effectively partner, integrate, reach people where they're at. And a lot of that requires education and outreach, and some of which we do with grant support, some of which is part of our healthcare reform transformation.
It seems like the challenge in some ways, though, for the health system could be you need to engage with community entities over which you have very little, if any, control. But again, we might be serving the same people, and we're trying to find a way to serve them more collaboratively instead of kind of piece by piece.
Yes, yes, and I think that as we as a health system get better at identifying those with extraordinary needs, and as we get a better understanding of the assets that we have in our county, that sort of collaboration allows us to leverage those partnerships in a much more meaningful way. Ways that serve the missions of those community stakeholders, ways that help us serve our mission, and ultimately the hope is that 1 + 1 = 3.
Right.
And we can reduce redundancy where there may be overlap and create greater efficiencies. So it's a significant task and something that's new to all communities.
And and again, you're the expert in population health. How do you think about? Do you think about it as one big group, or do you start to look at? You have this idea of people that need higher level. Is this kind of the Pareto principle? 20% of your people, or 20 and 80% of the impact. How is that what you're trying to identify? Where are those kind of outliers from what the norm is?
That's a great question. And the Pareto principle, the 20-80 rule, is definitely important when you're on one level focusing on the cost side. So we know that 20% may have frequent admissions or frequent emergency department visits. And from an outcomes and a cost containment perspective, there's a lot we can be doing to better serve that 20%, no doubt about it. But there's also this important aspect for those that are well, to keep them well and to help them maintain that wellness throughout the age continuum. And I think Berkshire County is a bit unique in Massachusetts in that we have an older demographic. So about 20% of our demographic is 65 or older. We know that we all have unique needs that shift throughout our life continuum. So we have this vibrant demographic, many of whom may need more unique services. You know that as well as anyone. And then we may have very young children who they come into the world with significant challenges. And so how can our pediatric community, for example, better partner with those human service agencies that can help kids at a very young age begin to gain traction in their lives?
And I know for us, and I think in the human service world across the county, we often, especially with our friends who are at the other end of the pike, have to explain to them what the challenges are of being in a very rural part of the state. And I'm assuming that's just another layer kind of complexity for trying to deal with the entire population. It
is, John. And when you focus on the social determinants, some examples of that are unique challenges in the Berkshires would be things like transportation. We know that many people don't have a car, may not have easy access to public transportation, which means they're less likely to get to their local senior center for a fall prevention program, or less likely perhaps to get to a timely follow-up appointment with a physical therapist or their physician. So those are unique challenges here in Berkshire County, and unique challenges require unique sort of solutions, and I think that's part of the one of the joys of this work is it brings me personally closer to so many amazing people that live and work here, and everyone's got their sleeves rolled up, and I think everyone has some vested interest in these high-level outcomes, and it brings us closer together.
And I know an area that we have started to see, both from the academic world and from the social work world, an issue that's becoming more and more prominent is social isolation, and the recognition of the role that can play in poor health outcomes and poor mental health, both mental health, emotional health, physical health. How does that play into kind of the larger population health issue?
Yeah, when you look at the health and longevity research, social isolation, loneliness may be one of the strongest predictors of not only how long we live, but how well we live, our capacity to thrive. So as we look at new models, an important part of that is connecting with others and connecting others to others. So a lot of the models that we're now trying to develop are group models, community programs that bring groups of people together, often who are sharing a great deal more than they might realize. And these might be diabetes classes. Another example through this work has been Matter of Balance, which is a falls risk reduction.
Right.
You bring people together and they start to really blossom. They realize that they're not alone on this journey. Others in the group can often help somebody, perhaps with transportation, or maybe they've done something in their home that they can suggest as an idea for someone who's got carpets that maybe need to be re-examined, or bars to hold on to. And so you begin to see small communities of people creating support that makes more likely an individual's outcome would be better than it would be otherwise. And so that's a really good example of a unique challenge in the Berkshires and some of the ways that we're looking to address those challenges.
And we certainly see that on our side. The example that comes most readily to mind is our congregate meal sites, usually hosted by councils on aging.
Yes.
And you can go, and whether it's once a week or every day or whatever it is, it's a very, it's typically a very similar group of people, doesn't change that much. And as you said, over time, it's noticed if someone's not there, and then a phone call is made, or they're sharing experiences, but also sharing resolutions to challenges that they're having, because they're all, as you said, they have a lot more in common than they have in different. And I think we see that at those congregate sites, and I know the councils on aging see them as well.
Yeah, exactly. And we hear stories all the time, as I know you and your staff do, John, of people who realize possibility through connection to others that might otherwise not be forthcoming. And for some, it's just feeling being cared for, a sense of compassion that maybe has been lacking in their lives. For others, it's just knowing that others care about you. And so to shift that perception is really important. And I think that, as you know, these models in some way need to create statistics or data that we can then demonstrate value for. And hardly a day or week goes by when our staff's not recognizing that Mr. and Mrs. Smith, for example, have not been in the emergency department as often because they've been part of this group. Mr. and Mrs. Smith perhaps are requiring fewer medications than they might have before starting a particular program. Mr. and Mrs. Smith's mood, as we would measure through the tools that we have for looking at depression or anxiety, shift over the course of that 6, 8, or 10 weeks. And that's really, as we know, where the rubber meets the road.
You can start to see it. And I know we sometimes run into that barrier of New England independence. I don't want any help, I don't need any help. And I think we often have the conversation that we try to share with folks is, getting a little bit of assistance does not mean giving up all of your independence. And in fact, can enhance the quality of that independence and the quality of life you have by accepting a little bit of assistance.
Yes.
And I think we often have that conversation with folks, especially on the front end of their relationship with us and case managers, that just a little bit of help can actually expand what you can do, as opposed to feeling like, oh, I don't need help, I don't want help, I don't want anybody, But we certainly run into that people are reluctant to kind of connect with the system, even though every statistic shows the earlier and the longer they're connected with a larger system, the better their outcomes are going to be over time.
Right, and those are very common perceptions, which we could all understand.
Right.
And so much of where I think the rubber meets the road there is in this work is creating that relationship capital. It's creating trust. That somehow people need to know that you're there to support whatever their values are around independence and around autonomy, not to threaten that. And that can, trust and trust capital is what this work is all about.
Right.
And one relationship at a time. And the more you engage, you begin to see those perceptions shifting. And I think that's where the secret sauce begins to really emerge.
Second thing, I know there was some press in the paper today, and I know you've been involved, but on Wednesday, you're going to be speaking at the Supergenarians Wellness Forum, a grassroots effort that's come up that we've both have been involved in, been supportive of. Talk a little bit about what you're going to talk about there.
Well, the Supergenarian Forum is a terrific example, John, of two amazing women, seniors in our community who are well and who strongly desire to connect with others like them, who are motivated to stay well, and to create a forum where we could bring some state-of-the-art health information to them. So I'm going to be talking about sort of a top 5 considerations of lifestyle that current evidence would suggest can powerfully maintain wellness if you're already in a good place, or profoundly address whatever disease or diseases a person may be confronting, like diabetes, or maybe a risk of Alzheimer's or high blood pressure. And I think one of the challenges that we're all, I think, more aware of is that there's so much information out there, it can be overwhelming. And it can be conflicting and sometimes contradictory. So part of my role from a population health perspective, and clinically I'm an integrative health physician, is to translate that information and to give people news to use, things that in a relatively short time can be understood, applied, and are actionable. And so we'll have some fun with that Wednesday morning. I understand there'll be a great turnout.
Yes.
So these are the seeds that ultimately help others begin to connect. And it's a beautiful thing. I'm really, it'll be a joy to participate.
Well, and I think one of the things that I'm sure you'll talk about, and some of the literature points out, there are some very simple things people can do. Like you started with movement. Just regular diet, those, modest alcohol, not smoke. I mean, there are some basic things that can have a fairly dramatic, but also a fairly immediate impact. If you're not very active and you start being active at a Matter of Balance or Silver Sneakers or whatever, the various programs that are out there, you can start to feel that effect fairly quickly. I mean, within 6-8, like you said, 6-8 weeks, you're going to feel different.
Yes. And I think while people are more aware of the importance of healthy living, a good diet, or more regular movement, I'm interested in helping them appreciate, what is a good diet? What do we know in 2018 that maybe sounds a bit different than how that news might have sounded in 2010? One example of that is fat may not be as unhealthy for us as we once thought. We now know through recent research called epigenetics that what is in our DNA, what we inherit, is much less hardwired in terms of our lives than we once thought. Lifestyle, as it turns out, will trump whatever your genetic predisposition or susceptibility might be. That's a very different way of empowering individuals to think about who they are and how they function. And a big challenge is appreciating that while physicians are important, I think people still perceive that it's the quality of the doctors in their community that are the greatest influence of how long they live. Well, that's simply not true.
Right.
So I do tend to be a little bit disruptive and shaking up the worldview that people may present with in ways that can purposefully empower a different way of thinking about who they are and just how powerful each choice is in our lives. And part of that challenge is examining assumptions that maybe we've held on to for a very, very long time that turn out not to be as true as we thought.
Now, the cynics in the audience perhaps on Wednesday might come back and say, well, wait a minute, Dr. Pettis, you know, salt used to be bad, now you're not quite sure. Coffee, caffeine used to be bad, now fat used to be.
Yeah.
How can we, as a society and as a system, that we share lots of information. This show, Berkshire Senior newspaper, we try and put out information. How can we counter that type of response to the people that kind of want to push, like, no, wait a minute, I've heard this before. You told me one thing 20 years ago. Now you're telling me something. How can I believe either one?
Right. And that's an understandable mindset. It's one that I've had, and I think that we've all had.
Yeah.
So I think, as our mothers once told us, experience is the best teacher. So part of what I try to motivate in others is to create an experience in their lives over a relatively short period of time, say 2 to 4 weeks, and then to examine how their lives change in response to that experience. One change might be, for example, eating less sugar, eating less sort of flour. I'll talk about that on Wednesday morning. Some people might challenge that, and my response is, well, if you're feeling well, then so be it. But if there's some aspects of your life that you think could be better, try reducing this for 4 weeks and see how you feel in response to that. Try eating some foods that maybe you thought weren't as good for you, like eggs and the egg yolks, some butter, healthy fat sources, if you will, and see how you respond to that. Try a simple breathing, stress-relaxing exercise for a few minutes a couple times a week, and notice if you feel differently in response to that. Let your experience in response to changing some conditions in your life guide what you're willing to accept or maybe reject. And ultimately, our bodies become the best teachers because they're wise and they tend to know what's best for us.
Do you think one of the barriers to that for some folks, though, is this is the way I've always felt? I mean, so how why should I feel? Is that one of the barriers that's hard to get over with this type of approach?
I think it can be, and it can be very hard to know how good one can feel if they've never really felt great.
Right.
And so I think a part of where I try to challenge assumptions is that getting older, for example, doesn't mean inevitably slowing down, having more pain, having less energy or less joy in life. That may feel normal to you, but here's a set of conditions that you can try to determine whether or not you might feel differently or better. And many people are surprised over time at that potential once it begins to realize itself. It's hard work, but I think the hardest part of that work is unlearning what we have held to be true. I think it was Mark Twain that once said, it's not that we don't know that gets us into trouble, it's what we know that ain't so. And I, in my own life, there are many things that I thought were true that have turned out not to be true, that lead to possibilities that one might not have imagined. But it's hard work, it's challenging work, and we all need help with that.
And we've certainly have begun, in the elder service world, there's been a lot more discussion and material that we've done and training for staff around the simple concept that everybody feels depressed at different times in their lives, but being depressed is not part of being older.
Yes.
And, these are not inevitable things that are going to happen. Everybody feels depressed, for various and sundry reasons, life activities, whatever.
Yes.
But it doesn't mean that that when you're older you should be depressed, or in a clinical way or in a long-term way.
Exactly, in much the same way that if my mother or grandfather had depression and I have it, it means that it's locked into my genes and there's nothing I can do about it. If that is one's narrative, if that is one's worldview, then that mindset makes more likely that that reality will in fact
becomes a self-fulfilling.
manifest.
Right.
And if you look at some of the mind-body research and consciousness research, and it's a little bit abstract, but we know that the power of our worldviews can very much guide what we ultimately experience in our lives. And changing that worldview is not easy for any of us, as we well know. So population health really does attempt to meet some of those critical assumptions head on, so that people can perhaps experience a very different day-to-day life.
Yeah, I know just from my own, my in-laws are both in their mid to late 80s, and my wife speaks to them every week, and recently she came back from the weekly phone call and said, oh, my dad's going to guided meditation. And like,
who would have thought?
What? Like, he's doing what? You could have said he was flying to the moon. It would have been just this. But he's really enjoying it. He was a musician, and so I think it plays into that mindset of having a regular practice, and he's really enjoying the benefits that he's feeling from a guided, in a group. He does it in a group with guided meditation. And
again, I think that trust and that relationship capital is so important. I think as people open themselves to perhaps considering something like meditation that they would have never otherwise tried, is made more likely if they're doing it in the context perhaps of a group of people, or if somebody that they're developing some trust and a compassionate relationship with is suggesting, try this. And so I think that's where these small glades of light can enter a life and then begin to illuminate in ways that one would not have predicted.
Clearly, we could talk about this for a lot longer, maybe multiple episodes. But I want to thank you for coming today, and I want to thank everyone for watching. And we hope you'll continue to watch Berkshire Senior TV. Thank you, Dr. Pettis.
Yeah, welcome, John.
Till 2:45, would you lock the door? Will you still need me? Will you still feed me when I'm 64? Dum 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 dum. You'll be older too. And if you say the word, baby, I could stay.